Hello and welcome to today's session. Today's session we are looking at edema formation. And edema normally affects the interstitial compartment space. Okay, so naturally we have three fluid compartments in the human body: intravascular, interstitial, and intracellular. Remember, before even we get here, our bodies are divided into two different parts. We have the solid part and the fluid part. In the females, we 55% is made up of the fluids, whereas 45% is made up of the solids. This is different from males, where when you look at the total body mass of a male, 40% is made up of the solids, whereas 60% is made up of the fluids. Now, on the fluids, they are divided into thirds, where we have two thirds representing intracellular fluid space, whereas a third representing the extracellular fluid space. Okay? Correct. So, for the intracellular fluid, this fluid is found within the body cells and it accounts for the two-thirds of the body's total fluid. Okay? You find that intracellular fluid contains water, dissolved solutes, including electrolytes and nutrients, and it plays a pivotal role in maintaining cellular function and homeostasis. This is different from extracellular fluid, okay, where this is the fluid found outside the body cells and is divided into two sub compartments. We have the interstitial fluid and the intravascular fluid. So the interstitial fluid is the fluid that surrounds and bathes the cells in the tissues. It provides a medium of exchange of nutrients, oxygen, and waste products between the cells and bloodstream. Whereas the intravascular, also known as the plasma, this is the fluid compartment of the blood found within the blood vessels. So plasma contains water, electrolytes, proteins such as the albumin, and various other solids. So it plays a crucial role in maintaining blood pressure, transporting nutrients, hormones, and waste products, and supporting immune function. So what is edema? This refers to the process by which excess fluid accumulates in the interstitial space of the body tissues. So this leads to swelling and there is normally an increase in tissue fluid. So it occurs when there is an imbalance between the movement of fluids between blood vessels, that is the vascular system, and the surrounding tissues. So edema can be localized to a specific area or can affect larger areas of the body. Okay, so that's where you are going to get things like Anasarca. And when we are talking of specific body, we'll be talking of the pulmonary edema, for example. So edema is often a symptom of an underlying medical condition and it can manifest as swelling, puffiness, and tightness in the affected area. So the pathophysiology of edema is that it involves disruptions in the balance of fluid movement between the vascular system and the interstitial space. So, and some of the factors that contribute to this is, number one is the capillary hydrostatic pressure. You find that capillaries are the tiny blood vessels that normally exchange nutrients, oxygen, and waste products between the bloodstream and tissues. So, hydrostatic pressure is normally found within the capillaries and it tends to push fluids out of the vessels and into the surrounding tissues. So, an increase in capillary hydrostatic pressure within the blood vessels, these smallest blood vessels, often due to factors like hypertension, congestive heart failure, it normally promotes fluid leakage into the interstitial space. And when there is leakage of fluid into the interstitial space, it results into the edema. Also, another factor is capillary oncotic pressure. And this oncotic pressure is the pressure exerted by proteins, primarily albumin found in blood. So this pressure tends to pull fluid back into the capillaries. So you find that a decrease in capillary oncotic pressure normally due to conditions like liver disease or malnutrition, it can reduce the ability of the capillaries to retain the fluid, leading to edema. Another factor is lymphatic system, whereby the lymphatic system normally plays a crucial role in draining excessive interstitial fluid and returning it to the bloodstream. However, if you find the lymphatic system is impaired or damaged, as seen in conditions like lymphedema or lymphatic obstruction, it can lead to accumulation of fluid in the tissues. Also, we have increase in capillary permeability. So you find conditions like inflammation, injury, and certain diseases can increase the permeability of capillary walls. So this means that capillaries become more leaky, and this allows more fluid and proteins to escape into the interstitial space from the intravascular space. This is common in conditions like allergic reactions and burns and also infection. We also have water and salt retention. So the body's regulation of salt, that is the sodium, and water balance plays a role in the edema formation. So conditions like kidney diseases or hormonal imbalances can disrupt this balance, leading to fluid retention and edema. Also, another factor, we have venous insufficiency, where problems with venous systems such as deep venous thrombosis or varicose veins can impede the return of blood to the heart. So this can result into increased capillary pressure, and consequently we have fluid leakage into the tissues, often seen in the lower limbs. Lastly, we have gravity, and gravity can affect the distribution of edema. For example, if a person is standing or sitting for long periods, fluids normally accumulate in the lower limbs. And when this happens, they lead to increased capillary permeability, capillary pressure. As a result, okay, this fluid is pushed to the interstitial space, and this results into the edema. We have different types of edema, like peripheral edema. You find this is the most common type of edema, and it typically affects the extremities, the hands, the legs, Pulmonary edema. This occurs when you have excess fluid accumulation in the lungs. Cerebral edema, accumulation of fluid in the brain tissue. We also have macular edema, and this is edema that specifically affects the macula, and this macula is the central part of the retina in the eye. Lymphedema occurs when there is blockage or damage to the lymphatic system, where the lymphatic system is not able to return the fluid from the interstitial space back to the blood. Okay. Also, another one, you have pitting edema, and this is we say it's pitting edema when you find that pressure on the swollen area leaves a temporary indentation or a pit. Okay, whereas the opposite is true for non-pitting edema, where there is no noticeable pit or indentation when pressure is applied to the swollen area. Dependency edema occurs due to the effects of the gravity. You find that it typically affects the lower extremities. That is when a person has been in an upright position for an extended period. It could be sitting or standing. Medication-induced edema. Some medications such as the calcium channel blockers like nifedipine, corticosteroids, and certain antihypertensive drugs can cause edema as a side effect. And this is very common in patients who are on nifedipine as one of the antihypertensive drug. Lastly, we have idiopathic edema, where the term refers to a known cause and edema just happened, okay? So we have this concept of Anasarca, and Anasarca is a severe and generalized form of edema. It can be an extreme case of edema in which there is widespread and excessive fluid accumulation throughout the body, affecting multiple parts simultaneously. So it's not just the lungs only, nor the peripheral only, multiple parts, Anasarca. Okay? So, you find that Anasarca typically leads to significant and noticeable swelling of the face, limbs, abdomen, and other areas at the same time. It's often a sign of a severe underlying medical condition such as heart failure, kidney disease, liver disease, or even echinococcus infestation. Okay, correct. So we also have another factor or key term that needs to be made clear, and that is ascites. This is a medical condition that is characterized by accumulation of excess fluid within the abdominal cavity, specifically the peritoneal space, okay, which is the space between the abdominal organs and the abdominal wall. So this build up normally leads to abdominal swelling and distension. So ascites is a type of edema but is localized to the abdominal area. Major causes could be because of the cirrhosis, heart failure, cancer, kidney disease, infection, portal hypertension, malnutrition, and pancreatitis. So when you get a patient with edema, you have to subject them to some form of assessment. And the assessment involves collection of symptoms, okay, that is getting history, and signs, that is performing some tests, okay, on the patient. So you need to ask the patient about the onset. When did it start? Is it gradual or has been sudden? You need to inquire about the activity before edema was noticed. What was he doing? Okay. Find out about the recent leg injury, surgery, or illness. Ask the patients about usually daily activities so that you find out if gravity is also a contributing factor in this case. Obtain history about medications, for example, the antihypertensives, oral contraceptives, and corticosteroids. And lastly, inquire about the history of cardiovascular diseases or vessel disease, which can have significant impact on edema formation. On your assessment, you need to examine the legs or the parts for the edema. You need to compare the parts, okay? You need to identify and locate the edema and whether you need to tell if it is pitting or non-pitting. Make sure you measure and record the circumference of each leg or the part affected by the edema at the same anatomical level so that you can be able to compare. Palpate and auscultate peripheral pulses. Observe the leg for color and look for initial vein patterns. Palpate for warmth, tenderness, and cords, and gently squeeze the calf muscle against the tibia to check for deep pain. Okay, this one is normally referred to the Homan. Okay, so if edema is only on one leg, you look for the Homan sign. Okay, now note skin thickening, redness, odor, unusual growths, or ulceration in the edematous areas. So guys, so how do you assess for positive Homan sign? So as a nurse, you need to hold the patient with the leg extended and the foot in dorsiflexion position, okay, dorsiflex, okay. Just know that a link on the anatomical movements will be popping up. You can try to review the different types of anatomical movement. So in this case, we are talking of the dorsiflexion, So the examiner will gently tap or apply pressure on the calf. Okay, so you dorsiflex, then you apply pressure on the calf muscle. So if the patient experiences pain or any type of tenderness, the examiner will determine that actually this is a positive Homan sign. Okay, yes, so you support the thigh. Okay, you try to abruptly dorsiflex. Okay, yes, so the patient will get some pain here or may fail to be able to dorsiflex. In identifying the pitting or non-pitting, we are saying that you identify the location of the patient's leg edema. You use the thumb and the fingers. You gently press on the area of the edema and release. Okay, so if the residual fingerprint or the thumbprint remains, the patient has pitting edema. Like for my case here, the patient has pitting edema. Okay, correct guys. So a client with venous insufficiency reports swelling in the feet and ankles. What is the most appropriate intervention for a nurse to recommend? Should you limit fluid intake after 8 p.m.? Buy well-fitting walking shoes? elevate the feet several times a day, wear a pair of knee-high support hose. Okay, guys, we all agree with Nasi. Nasi is saying you elevate the feet several times, and that is okay for our patient. Remember that elevating the feet will promote venous return and decrease foot and ankle edema. Limiting fluid intake is not recommended unless there are additional medical conditions such as heart failure. Limiting fluids after 8 p.m. can help with nocturia, but time is irrelevant to edema prevention. So buying walking shoes will not necessarily decrease edema. So over-the-counter knee-high support hose are not the same as medical grade graduated compression stockings. And there are some contraindications to compression that should first be ruled out, okay? Because you may be having deep venous thrombosis, okay? Resulting in pulmonary, okay? Yes. So the pulmonary edema can complicate, okay? So that you have now pulmonary emboli, which is an emergency. So therefore, the nurse should not recommend this intervention unless the elevation of the leg fails to solve the edema. So at this time, the client should consult the healthcare provider or the physician about the use of medically approved compression stockings. So we have 5 priority nursing diagnoses for a patient with edema. Number 1, we have impaired skin integrity related to prolonged pressure and edema as evidenced by erythema and skin breakdown on the sacral area, followed by excessive fluid volume related to compromised renal function as evidenced by weight gain of 5 pounds in the past week, peripheral edema, or it could also be elevated blood pressure. We can also have infective peripheral tissue perfusion related to impaired venous return as evidenced by cool, pale extremities, diminished pedal pulses, and capillary refill greater than 3 seconds. We could also have risk for falls related to impaired mobility due to low extremity edema and weakness as evidenced by unsteady gait and use of walking aids. Lastly, we can also have deficient knowledge related to edema management as evidenced by the patient's request for information on dietary restrictions and medication side effects. Guys, we can pick either of these nursing diagnoses that could be relevant for your patient. So in management of edema, we normally use a mnemonic EASE, where E stands for evaluate, assist, support, and education. So in evaluating, you begin by assessing the patient's edema, okay, including its location, severity, and any associated symptoms. Make sure you document the findings accurately. You assist the patient with activities that promote edema management, such as elevating affected limbs, the one that we've just indicated, ensuring they take prescribed medications, could be diuretics, okay? You provide emotional support to the patient as edema can be uncomfortable and may have underlying causes that require ongoing care and attention. Guys, a link on therapeutic communication of a nurse will be popping up. You can also review to know what to say and what not to say to the patient with edema. Lastly, we have educate the patient about underlying causes of their edema, the importance of medication compliance, dietary restrictions such as sodium intake, and self-care measures like limb elevation and exercise. So the commonest drugs that we normally use, we normally abbreviate them as flat pad, where F stands for Lasix. We have hydrochlorothiazide, amiloride, triamterene, potassium sparing antidiuretics, acetazolinamide, and mannitol. So when you look at the thiazide diuretics, and good examples are hydrochlorothiazide, HCTZ. This primarily works in the distal convoluted tubules of the kidney where they inhibit reabsorption of sodium, chloride, and water. So by doing so, they increase the excretion of these substances in urine, leading to increased urine output and fluid loss, and edema may resolve. Loop diuretics such as furosemide and butanide, okay? So these primarily work on the thick ascending loop of Henle of the kidney. So in this one, they inhibit reabsorption of sodium, potassium, and chloride ions. So this powerful effect normally results in significant increase in urine output, making loop diuretics suitable for addressing more severe edema. Next, we have potassium-sparing diuretics such as spironolactone, aldactone, and amiloride, which primarily target the collecting tubules in the renal tubules. They work by blocking the action of aldosterone, okay, or so like for the spironolactone, or directly inhibiting sodium reabsorption, like the amiloride. So these diuretics help remove excessive fluid while preserving potassium levels in the body. We have osmotic diuretics like mannitol. They work in the proximal tubules and descending loop of Henle. So they decrease the osmotic pressure in the renal tubules, which inhibits water reabsorption and promotes the excretion of water and solutes in the urine. Mannitol is very important in reducing intracranial pressure in cerebral edema and preventing acute kidney injury. We also have the carbonic anhydrase inhibitors. A good example is acetazolamide. So you find that carbonic anhydrase inhibitors, they work in the proximal convoluted tubule of the kidney. They inhibit the action of the enzyme carbonic anhydrase, which normally facilitates bicarbonate reabsorption. So by doing so, these diuretics normally interfere with the reabsorption of the bicarbonate and sodium ions, resulting in increased urine output. So acetazolamide is used specifically in conditions like glaucoma and metabolic alkalosis. Remember, we could have combination diuretics whereby they contain a mix of diuretic agents that are going to have different mechanism for us to have a effect on the edema subsiding. So on patient teaching, remember that as you discharge the patient, you teach the patient on the proper application of anti-embolism stockings or bandages. You need to instruct your patient in appropriate leg exercises. Inform your patient of the foods and fluids to avoid as well as salt restriction. Teach the patient about the monitoring of weight daily, okay? Also, describe how to check for the pitting, okay, so that you know if it's pitting edema or non-pitting edema. And lastly, encourage elevation of the legs when sitting. Urge the patient to avoid prolonged sitting and standing and not to wear constrictive clothes because that could contribute to edema formation. Thank you so much, and you can try to test your knowledge and reinforce your understanding by attempting the free quiz in the description section.